Welcome to Public Health Matters, where we talk about what matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And before we welcome our guests today, I want to give you a little bit of a COVID update. So you'll see up on the map that wahoo, New Hampshire is in low transmission right now. So that's great news before we head out for the holidays. But that being said, if you are in indoor crowded places, we do hope that you will wear a mask and protect yourself and your family. So that's great news for us. But there are a lot of other viruses going around right now, RSV, especially among children and those over 65. So again, please stay home if you're not feeling well, and visit your doctor, call your doctor if you are feeling sick so you can get tested, and make sure that you're doing your isolation should you have COVID-19, or if you have RSV as a kid, your family, please, do not go out and spread the good word there. So we also want to remind people that the bivalent booster is available. This protects against Omicron and the original strain of COVID-19. And just to let people know that there was a study out today, at least Moderna put out one study, that they are finding their new bivalent booster very protective against the new strains of Omicron. So that's great news for us, great news for me because I had the Moderna bivalent, but either way, we do want you to go out and get that booster. And it is recommended 3 months after infection or 2 months after your last vaccination. And a reminder that it is flu season, so if you haven't already, please get that flu shot, crush that flu bug. A yearly flu vaccine is the first and most important step in protecting against the flu. Also a reminder that we have monkeypox vaccine clinic sites. Most of the convenient MDs are offering the vaccine, as well as some you'll see on the map all around the state. If you have any questions about monkeypox, please email monkeypox@dhhs.nh.gov. And now to welcome our first guest, Dr. Albee Budnitz. Welcome, Albee.
Thank you very much. It's great to be here.
It's so nice to have you here. We go way back, so full disclosure, way, way back. We won't tell the story, though, that we just told. So Dr. Budnitz is a retired physician and a fierce advocate of not smoking, not using tobacco or any of those related products. But tell us a little bit about what you've been doing since you've retired.
Well, I've been busy with, you'll see our next guest, with something called the Nashua Prevention Coalition, but originally, historically, in 1995, it started as the Nashua Smoke-Free Youth Coalition and morphed into the Nashua Prevention Coalition when youth surveys showed that they were concerned about opioids and other addicting drugs, especially that they got out of their grandparents' medicine cabinets. And being a grandparent of 8, that was of concern. So now with the Nashua Prevention Coalition, you'll hear a lot more about that soon, I think.
Okay, so stay tuned.
Yeah, stay tuned. So I'm working with them, and I also volunteer at Breathe New Hampshire, which used to be ALA of New Hampshire, and before that, 10 other names. It's the oldest lung health voluntary agency in the state. Started in 1916, so that's over 100 years, somewhere up there. And yearly, I'm involved with the annual C. Everett Koop tobacco conference from the Koop Institute up at Dartmouth. That's what I'm doing. And enjoying myself.
Oh, that's good. That's good. I'm really glad you're enjoying yourself. So we're just going to cut right to the chase. And I can't believe I have to ask somebody this, but we're going to reinforce it. So why is smoking bad for you?
Well, we've made actually tremendous strides in the smoking population. In the last 75 years, we've probably, outside of vaccines, it's probably the #1 stride in health that we've made, public health that we've made in this country. But despite that, it's still the #1 killer, #1 cause of preventable death in our country, and preventable death and disease. With everything else that's gone on, even with the pandemics, it still doesn't reach the number of preventable deaths that tobacco-related disease and tobacco use disorder cause.
So what are some of those diseases that, smoking is a risk factor
Well,
for?
smoking as the granddaddy, I call these the shame and blame. Actually, I don't call it the COPD Foundation calls it the shame and blame diseases. But November is Lung Awareness Month. It also is COPD Awareness Month and Lung Cancer Awareness Month. And all of those relate directly to smoking. In fact, World COPD Day was 2 days ago. And Great American Smokeout is now well into its third or fourth decade, and that was earlier this month as well.
So, smoking can also contribute to bad outcomes with heart disease.
So the big killers from smoking are cardiovascular disease, that's the number one, heart attack and stroke. Number two is COPD, chronic obstructive pulmonary disease, which is essentially the combination of bronchitis and emphysema, chronic bronchitis and emphysema. And the third is cancers. It's the cause of over 30% of all cancers, about 80% of lung cancers, about 96% of bladder cancers, which might be surprising to some,
Wow.
but 30% of all comers as far as cancer goes. So those are the three big killers of tobacco-related disease. The bigger concern these days, maybe we'll get into, but it's something I like to call, it's not, I didn't make it up, but tobacco use disorder.
We'll come right back to that.
Okay.
So you talk about, all of these things it contributes to, and you talk about, preventable, especially around cancer, because we did have Dr. Gautami Rao on a few weeks ago, and she mentioned also how much of cancer is preventable. And again, that's that prevention of that not smoking, quitting smoking, quitting tobacco use, so that you can prolong life and quality of life. And so I love that you said we've made great strides in public health, because we gotta prop up public health a little bit. What people don't realize, it's, mitigation efforts include quitting smoking. So that is something that the public health profession has been working on for years and years and years. And so the rates of smoking have gone down tremendously.
Tremendously, yes.
Especially among our youth. Well, not especially, but they have.
Well, smoking has.
Smoking has. Yeah, we'll get to the other one, that word. But, there are, this is evidence-based. This really is true. You quit smoking, you increase your quality of life, you increase,
longevity.
Yeah, the
your
length of your life,
yeah.
Everything. So, so the smoking rates have gone down among youth. I know you started really working on this, as you said, long time ago, with the youth and tobacco prevention. So now we have vaping, which is a huge problem. It's kind of taken over as smoking rates have declined. What I've seen is that the vaping rates have gone up among our youth.
That's correct.
We have the youth behavioral risk survey and our youth risk behavioral survey. I always mix up the initials.
YRBS.
YRBS,
Okay.
and that tells us that youth are smoking less but vaping more. And so, what's the problem with that?
Well, I think the problem is the other disease I mentioned, tobacco use disorder. And that is because tobacco is, up until recently, is probably the cheapest source of nicotine, which is a drug which is addicting, and it's the cheapest source one can get to make a product that will addict you. And the cigarette, the smoked combustible cigarette, is still the most advanced and most efficient way of delivering a drug to the body that we know. Smokers can get exactly the dose of nicotine they need. They know how to inhale it, so they get just what they need. And the problem now has come up in that we're in the fourth generation of vaping. Vape came into this country in 2007, peaked in use in 2019, and it has come down since then. That's the good news since 2019, although the data is a little hard to interpret because the data was collected differently during COVID than prior to COVID. But we definitely feel it was well over 5 million vape users, with probably 90% of them being youth, meaning at that time it was under 18. Now we can say nationally it's under 21. But anyways, 90% of users being youth, kids, adolescents, and young adults. And it's come down to about over 2.5 million vape users, and youth are still using there are about 3 million youth using it. There's been a lot of data that's come out in the last month. Since October 7th, there's been 2 reports in some wonderful magazine called Morbidity and Mortality Weekly Report.
Some light reading.
And then that report, as well as some other things, stimulated some articles that came out from really today's warriors against tobacco-related disease and tobacco use disorder. The reason we're concerned, getting back to your original question as I go off on tangents, is that
Tangents are okay.
tobacco use disorder means you're addicted to nicotine. And we've known since Dr. Koop's 1988 Surgeon General report that nicotine is an addicting substance as or more addicting than other substances like alcohol, cocaine, not quite as addicting as certain intravenous heroin, but those are the ones that it was evidence was developed about. And the cigarette being such a good delivery device of nicotine, someone once said, and I can't remember the quote, I mean the person who said it, but you smoke for nicotine, but you get killed by the rest of the stuff in the cigarettes. So the concern we have with kids smoking is getting addicted to nicotine. And if you went strictly by the science that we know very well for over 30 years now, is that the brain is the last organ in the body to develop, fully developed around 25, give or take. For some reason, girls develop 3 years earlier than boys. I don't understand that, but anyway.
It's true.
That's true.
I'm glad to have evidence of that.
But there's evidence but the developing brain, and again, on the mean about 25 years old, is very susceptible to addicting substances. And nicotine works on the brain in the same place that alcohol and opioids and the THC component of cannabis all work in the same place. And it was felt again since Dr. Koop's original report showed this in 1988, that it's a gateway to these other substances. The problem with the other substances is that they are psychoactive and intoxicating, and nicotine can be, but the way that combustible cigarette delivers nicotine, the smoker can get the exact dose he needs to sort of relieve why they're smoking, the anxiety and things like that, which unfortunately they get a double whammy because in 2 hours the nicotine wears off, and then you don't only have the anxiety you started with, but the increased anxiety from the withdrawal effect of the nicotine. But anyways, they start with the nicotine, and then they move on to other substances. And so the problem with vaping is that it has, especially the 4th generation, we're on the 4th generation of vaping devices now, and the big tobacco, which owns 3/4 of the vaping manufacturing companies, are way ahead of us. Their main bottom line is the bottom line, profit, so they don't have to worry about other things. And they have developed vape devices which deliver nicotine as well to the brain as a cigarette, but you can't control it as well. And they're much higher doses, and they're much less harsh. They've put flavors in them, and they've acidified it so that it's a much less harsh hit that you get of the nicotine than you get with a cigarette.
Less burning probably in the throat, that kind of thing.
Exactly, less burning in the throat, less harshness in the throat, so it's smooth. It really is smooth, and it smells good and it tastes good, and the result is kids are getting addicted, and that's our big concern with kids. And actually, anyone who is using any nicotine product or tobacco product, I'll just say tobacco product, but now nicotine is, even the synthetic nicotine that's out now is regulated under tobacco product law that came out in 2009. And everybody agrees, adolescents, young adults, adult non-smokers, and folks who are pregnant should not use any tobacco product or nicotine product of any type, period. Everybody agrees with that. Even the tobacco companies say that. Of course, they still advertise to kids, and kids, the reports that came out in that wonderful MMWR showed that more than 85% of kids use flavors, and they are kind of neat devices. Some make big plumes. That's the 3rd generation. The 4th, not so much, but they come in great flavors. They're not harsh. They have huge amounts of nicotine in them, and they get addicted very easily. And even though half of them want to get off, 3/4 can't, although we have a program in the state to help with that.
That was going to be one of my questions.
Oh, I'm sorry.
That's okay. So vaping is definitely a problem, and
still epidemic, not pandemic, but still epidemic among kids,
among children, kids, and so where, and this really is one of my questions: where can a student get help to quit vaping?
So our Department of Health and Human Services has the tobacco prevention and cessation program has a program that they developed with National Jewish, one of the national vendors to help, that has tobacco treatment specialists to help people off of tobacco, called My Life, My Quit. It's one of 2 programs that are specifically aimed at kids 18 and under. And this is strictly for kids 18 and under. They can go to My Life, My Quit. They can use it as a text. They can use it with email, which I know is old-fashioned. But they can use it with a telephone, and it's confidential. It's strictly for kids, and they will have their own tobacco coach, tobacco quit coach, or nicotine quit coach in this particular case, that can help them quit with what we know hopefully will help. We have excellent data on smoking. Data on gathering to quit vaping is coming, but it's only been 5 years or so. We have 50 years of experience with smoke.
Right. So we'll pop that screen up there after, but it's 1-800-QUIT-NOW is one way to access it, or Quit Now New Hampshire, quitnownh.org is another way to access it. And they have all sorts of things: text to quit, chat to quit.
Yeah.
There's a lot of resources. So that's not just for youth. If you are an adult who is smoking combustible cigarettes, the regular traditional cigarettes, this resource is for everybody in the state.
Yeah, absolutely. The 1-800-QUIT-NOW is for everybody, including adults, and they will get their quit coach within 24 to 48 hours or so, calling them and then figuring out how they want to communicate. And there's free nicotine replacement therapy, which is a well evidence-based way to treat addiction to nicotine.
So just for the layperson, nicotine replacement is like the patch, and there's gum, and there's lozenges, and am I missing anything else?
Yeah, there's a nasal spray, and there's an inhaler. Those 2 you need actually prescriptions for. The patch and the gum and the lozenges, which most of us start with anyway, are over the counter, but with the program that New Hampshire has, is a 2-week free supply, and if you're doing well, they'll keep it going for maybe a couple more times, total of 6 weeks. But it is over the counter, and it is FDA approved. It is pure nicotine, and it's not at the level that you see, for example, in the 4th generation vapes. So it's something you probably will actually get off a little bit more easily because it's not inhaled, and therefore it takes longer to get into your system. For smokers, and they're using this for vapors on nicotine as well, usually start with a maintenance drug, which is a patch, which just stays on for 24 hours, and then an as-needed drug, which I usually use the lozenges, 2 or 4 milligram lozenges, depending on how much nicotine you're using, and you can use up to 10 or more a day.
Yeah. So there is help out there.
Absolutely help out there.
And I actually am a trained tobacco specialist, but I haven't been using that in a while because of COVID. And I know that one thing we often encourage people is that quitting smoking is very difficult because of that addiction component that you've just described to us. So I just want to remind people that don't give up. It may take more than one try. It will probably take 10 tries.
Yeah.
That's what the literature says. But if you are on your path and you smoke a cigarette, it doesn't mean you have to start over. Just, give yourself a little grace.
Absolutely.
And then get back on that wagon again.
Every time you try to quit, even if it was just for the one day of the Great American Smokeout each November, that's a dose of medicine towards being a former smoker forever.
Yeah. And also just letting your loved ones know how this feels. I would really like it if you quit. Like, the more reminders people feel in their lives, it does compel them to take some action. So there is help out there, and that's great. And so the other last thing, so it is COPD Awareness Month as well. So any advice for those friends of ours, get moving, pulmonary
Yeah,
rehab?
COPD has lots of good treatment these days. One that's very poorly utilized that I think is one of the best is non-medicinal, which is pulmonary rehab. And so if you have a diagnosis of COPD, talk to your doc about being referred to pulmonary rehab. We have some excellent rehab ones in the state. They'll tell you about, get education about COPD. You'll be put in an exercise program where it's safe and shown how you can continue it at home. You'll talk about nutrition, and all of that will help. And there are good drugs as well. So, and then if you're really in a very severe and have a lot of exacerbations of COPD, flares of COPD, there's treatment that includes surgery or other invasive treatment that's short of surgery that can help for a very select population. But don't let yourself get that far, although it's never too late to quit. If you quit by the time you're 40 or 45, you can almost gain 10 or 12 years of life at the other end of life, and so on as you get older.
Right. So we're going to keep the faith. We're going to hope people call that 1-800-QUIT-NOW, or there's quitworksnh.org. They're just quitting in New Hampshire. You can just Google it.
Okay, so quitnow.org is for patients, and QuitWorks is for healthcare professionals if you want resources.
Okay, well, they're hopefully watching too.
Yeah.
And so thank you so much, Albee, for coming and also like fighting the good fight for so many years.
Well, thanks for having me.
The importance of prevention, because you know, it speaks to all of us in public health, and hopefully it's speaking to our audience today.
Thank you very much for having me.
Thank you. And we'll be right back.
Is drooling healthier than smoking a cigarette?
Nah, neither. Stay active, kids.
Welcome back to Public Health Matters. It's my pleasure to introduce our next guest, Michelle Ricco Jonas. Welcome, Michelle.
Thank you. Nice to be here.
So you are from the Nashua Prevention Coalition.
Yes.
And we thought that would be a great complement to our discussion about smoking cessation.
Wonderful.
Or tobacco use disorder, as Dr. Budnitz will correct me 100 times. Someday I'll get it right.
Yeah.
And so welcome to our show. And tell me a little bit about you and then the Prevention Coalition.
Sure. So I have about 25 years of experience in prevention, from the local level to the state level. And I really enjoy the local level. I'm having so much fun. I've been with the Nashua Prevention Coalition now for 6-7 months, I think.
Okay.
So getting up to speed, seeing all the great work that the coalition has done over the years, working with an amazing group of folks on the steering committee and the groups across Nashua. So I'm new to Nashua too. I recently moved. June of this year I moved to Nashua.
So this is full Nashua immersion.
It's full Nashua immersion.
That's awesome.
Yeah.
Because I think it's easier to do things, to be living in the place where you're trying to help.
Agreed.
It tends to be, anyway.
Yeah.
Not necessary, but.
No, but I think it helps because you're building relationships that it's your community.
Right.
It's a little more investment.
Absolutely. Yeah. So the Nashua Prevention Coalition is part of the United Way.
Correct.
So that's where your office is, or if you, I don't know if you're, well, you don't have to tell us if you have an office there or not. It's a very small building.
I have a couple of offices.
Yeah, very small building. And when was the coalition started? I know that, we just had that information. Never mind.
I think it was, it started out as a tobacco prevention program. And I'd have to look back at the time that it, increased to all of the substances, but it's certainly been around for a long time.
And a big part of the Prevention Coalition is youth engagement.
Yes.
So let's just talk about all those things you've been doing with youth.
I'm really excited about with the youth. There's a lot of fun and neat ideas. There's the historical activities that the Youth Coalition and the youth themselves have done. We actually have 9 youth leadership groups in Nashua right now.
And what does that mean?
So our high schools, our middle schools, and some of our youth service agencies work with kids to do prevention in Nashua. So it goes from crafts and arts and resiliency skills to, looking at laws and legislation and how that impacts them. The other thing we're wanting to do is to get these groups working more closely together. So we have a plan in place. Folks may know about the Youth to Youth in Dover. It's a best practice organization.
I know about it,
with
but I
youth.
don't know if other people do.
Yeah, so it's they've been around since the 90s, working with youth. But what they really do is they build up their capacity, their knowledge, their experience. They're the ones actually going out into the community and educating the community versus the adults. So, kind of thing. It's much more effective when people are hearing it from the youth themselves about what they need and what needs to happen in their communities. So we're fortunate enough to actually start collaborating with the Dover Youth to Youth to replicate that model here in Nashua.
Great. So hopefully those 9 different groups will start forming that kind of a coalition almost of youth.
Yeah, exactly. And the steering committee also put to task that we have a youth steering committee so that they are actually, making more of the decisions or guiding, some of the things that we're doing because they're living it.
Right.
They're in the schools, they're in their communities, they're in their families.
Right. So they're seeing firsthand. It's lived experience.
Exactly.
We always talk about that in public health too, is having those folks with lived experience as part of the solution.
Yes.
Because they're seeing it. I do want to back up. You said you have a steering committee.
Yes.
So who? What?
So we have different folks. Dr. Albee is one of them. The United Way has a representative with Mike Appleberg. We have some folks that are part of the youth organizations. So Nashua Pal is sitting. We also just invited the superintendent of the Nashua district to join us, and they've accepted it. We have another group that does youth diversion, student assistance programming. They're joining the steering committee. So we're sort of broadening the net of the thinkers and the doers that are in our community so that we're more enriched with information and best practices.
Great. So that steering committee, and then you have that youth steering committee. So is that a representative from each of the 9
of
groups?
the 9, yeah. That's what we're hoping. That's what we're aiming for, and that's a little different than what the Dover Youth to Youth does, in that we're having this sort of each of the youth leadership groups having a representation at the table, and then hopefully they'll bring it back to their individual groups, and we're really blanketing then Nashua, and not everybody kind of doing their own thing, and not really saturating the message as much, but bringing them all together will allow us to do more saturation.
Yeah, I had the opportunity, I believe it was one of our legislative breakfasts where we had someone from the Nashua Prevention Coalition speak to the local legislators. And, it's very powerful hearing it from a student.
And that's what our new program is going to do. We're going to train the youth to be able to run their own trainings, educate the community, educate our legislature, and be those powerful voices.
So we'll 100% be in touch because we've just scheduled our legislative breakfast again for
good.
Nashua. So, we're always looking for that.
Sure.
That it's just so important because, the eyes and ears, the boots on the ground, what are they seeing? What are they hearing? What are their concerns? What would work?
Right.
Because that's another thing. We can sit here and up in our castles and come up with ideas all day long, but we really need to ask the kids, like what would work, what is effective.
That way we can
what
engage
resonates
them.
with them.
Yeah.
So that's really great, and good luck with that.
Thank
getting
you.
that to, because I do know about Dover Youth to Youth, and that's been quite an amazing group.
Yes.
So it would be great to have that same thing here in Nashua. So what are some of the other things we have? I have a whole list here, but maybe you want to start with your list.
Sure. So I think what I'll do is I'll start off with a campaign, sort of like not a name change, but we really wanted to focus on how do we bring prevention and services across the continuum, and how do we build a coalition. So we came up with Project Impact, and collectively, a number, 6 or 7 other agencies have joined the coalition in writing for a multi-million-dollar grant through the state. We're still waiting.
I was going to say, do you know yet?
We don't know yet, but we're very excited about the opportunity if it happens, and if not, there will be more opportunities, with other rounds. But ideally, we were looking at services that go across the continuum. So, primary prevention, intervention, and diversion kind of things to treatment and recovery. And we were fortunate to get members across that spectrum to join this joint thing. So it's Project Impact. And under Project Impact, going back to the youth stuff, this leadership piece is going to be added to it. And the other exciting thing is that having them see that there's the continuum, that we can't just sort of whack-a-mole the problem. I know that's a offish kind of comment, but sometimes that's what we're doing. Sometimes, and so we really need the community as a whole, looking at how things are happening across the continuum. So looking at that data, seeing what we can do about it. I know that you had talked before about some of the data. There's data that we still need to get, that the state has, and they're still figuring out how to get that data to us.
Yes.
But with that said, data is one piece of it, but having the capacity to do something is the other thing, and that's where Project Impact is coming through. One of the major, risk factors across the board is capacity, and having the workers and having people that can fill these spots when we find out we need to do something. So that's what a lot of what our grant application also led to.
Around workforce?
Yes, workforce.
Yeah, that seems to be a common theme everywhere I go for especially around behavioral health and mental health. And when you're talking about substances and substance use, you do, especially across the continuum, where do you have these workers? And there just aren't enough. And so
it's
a big advocacy thing as well.
You talk to youth, you get them to a point of contemplating, like, I'm going to make a change, but then we don't have anywhere to send them to.
Right.
And then they're like, so why did I bother?
Right.
Nobody can help me, kind of thing. And that's where we really need to be paying attention in Nashua and supporting the services that are in place by bringing the capacities back up.
And it's also, sounds like you're doing a little bit of coordination too among those groups, because you have that youth, you have like the youth council, for example, that's in there with their advisory program and getting the students funneled through that. Just to make sure that people know those services are available.
Exactly.
But again, sometimes that's not enough. We need even more.
Well, I think sometimes we get stuck in our groove. Each group can say, oh, well, this is what I'm doing. But how do they all attach?
Right.
How do we make a healthy community? We all have to work together and understand what everybody's doing. And so I think that's part of the role that the coalition has to play, is bringing partnerships together, and not to say, dictating what they're going to do, but to coordinate what we're doing.
Absolutely.
Yeah.
Well, I am waited with bated breath to hear about that grant.
Me too.
Because I remember seeing all the emails going back and forth, and that was not anything we had capacity to work on at that point. So I was really thrilled that you guys took the lead to do that. And then you have Red Ribbon Week, which did just pass.
It did.
But even so, let's talk about Red Ribbon Week.
Yeah, the exciting thing with Red Ribbon Week is we got it all the way down to the elementary level this year.
Nice.
Which was nice. So it was we gave them ideas, but gave them, the latitude to change it up based on what the kids wanted. We're getting photos back now, and it really hit all of elementary. It hit our middle schools and it hit our high schools. So we were able to come.
And that's substance misuse prevention?
It is.
Or is it all substances?
Well, we look at it at all substances. I know that historically it started out with illegal drugs coming into our country and those kinds of things. But it's really taking a pledge to live a healthy life, and that's what we work with the kids to do. And the agencies that are in Nashua are amazing. The creativity they have, the tenacity they have. I love going to visit the groups because it just sort of fulfills sort of the mission that we have.
Right. Yeah. That's great. And so some of your you mentioned the agencies. So who else, I know the Youth Council, who else are you coordinating with?
Yeah, so with Project Impact so far, and really whether they're receiving funding or not, it's any agency. But the ones that pulled together for this application was the United Way, the Smart Start Coalition specifically, Lamprey Health, Greater Nashua Mental Health. We had the Youth Council, Bridges, the domestic violence group.
Nice.
And we also had Marguerite's Place as well. So we're looking at folks who are covering homelessness to domestic violence to, I think we covered.
Yeah, soup to nuts.
Yeah.
There's probably still somebody
And there's still
that's
some
not
more
there.
nuts. Yeah.
And would they be able to join, or their funding, the funding is the, so that's the thing about grant funding. Sometimes it's very pigeonholed and it's very prescribed. Do you have any flexibility with this once you get it, or not necessarily?
Not with this particular application. It was our first, we wanted to start to fill some of the holes that are present. Again, specifically, a lot of capacity is going to be built here. And then my understanding is that there'll be more issuance of those RFPs where we can then do that and work together to find out where are some more of the holes and how do we continue to grow.
To build that. So that's great. And then I know that there was a youth video project. Is that something that's still going on?
It's still going.
So tell us a little bit about that.
So we're actually we're focusing on vaping and nicotine this year specifically. So we've just started to get the materials out to the youth leadership groups. We're hoping now that everybody's kind of back and not having to Zoom all the time, we can get them more activated and be part of it. So we're hoping, to have more of the youth submitting their videos as it relates. One of the first steps is we've asked them to come up with the theme. So instead of us prescribing, we sort of have the idea, it's around vaping and nicotine, but what's the theme? What's the message? And then the winner will get some gift cards to Chunky's, which is where we host the Youth Video Project every year in May.
Oh, that's awesome. And one thing we can do here is have them come on and do a show.
Oh, that'll be wonderful.
And show the videos
Oh,
so that
that'd be
everyone can
great.
see them on Public Health Matters. And it's something I think I had spoken to with someone at the United Way, but it was kind of the COVID years.
Yeah.
So it didn't happen.
No,
But
that would be fun. They would love that. Yeah.
Yeah, it's fun. And I did talk to our producer here, and they can show them while we're, they do the magic behind the scenes.
Awesome.
So that's exciting. And then what, we have the Gratitude Project.
So the Gratitude Project is happening now. In fact, all the materials were delivered yesterday, and this afternoon the final ones will go out. And basically what we asked the youth leadership groups to do is to identify a group, an entity, a person in the community that they want to share gratitude for and thank them. So they've been given a board, they've been given materials to write things of what they're grateful for, and then deliver that to the person or group that they've selected.
That's awesome. So how many kids are in each group? Does it really vary?
It's growing. So I know the high school ones are about 6 to 7 per group right now. Middle school we've got to get back up and going. It pretty
That's
much
a tough
crashed.
year.
And it's really around the nation, these are youth groups, because they weren't meeting. They couldn't go out in the community to do things. So we're building that out, and we're hoping our high school youth will help us. That's going to be one of the first trainings we do is with the high school youth, and then have them help us train the middle school youth and the other service agency groups.
Yeah. It does take a little rebuild. I feel like we're in rebuilding years for a lot of things.
Yeah.
Around work and even social things or nonprofits and their fundraisers. Everyone's rebuilding a little bit. So did I miss anything? Sign our pledge.
Yeah. I guess the one other thing I would add that we're hoping to do, and again with the assistance of our trainers with Youth to Youth, is to hold an annual conference in Nashua, youth conference. Have the youth sort of design it, figure out who they want to be the speakers, have a poster presentation, so we're getting folks involved, and they may be speakers themselves. So that's another thing we're really hoping
Oh yeah, that
to
sounds
move
great.
forward. Yeah.
That sounds like fun. So if people want to volunteer, can they volunteer with the Prevention Coalition?
Yeah, absolutely. We actually have a great partner with Riviere University. We have 3 interns starting in January with us this year.
Nice.
So it grew from 1 last year to 3 this year, and I'm very excited to work with them.
And will they be working with the groups, or what will they be doing?
So one will be working on the youth development piece. The other is our social media and our website, those kinds of things.
Very important.
We
You
need
need young people.
We need that vision out there. And the other one is going to be helping to work on the conference.
Wow, so that's great.
Yeah,
Well, that's exciting.
it is very
you guys
exciting.
are growing.
I know.
Yeah, very good. Well, it's growing a lot since you came, Michelle. So congratulations.
Thanks.
So you take interns, but what about a community member? Can they
So
volunteer?
we've had community members want to volunteer. Sometimes we have to put things together for activities. We're a great partner with the rec department, Nashua Rec Department. They amazing activities, especially during the spring, summer months. And we're always looking for volunteers to help us do tabling activities. We also have tables at the Silver Nights.
Okay.
So things like that, where to me, those are kind of the fun ones that people can do, but also get our messages across.
Right.
Because you're engaging them in a fun activity, giving them some information
Right.
about the coalition and that kind of thing. So we always look for volunteers.
Okay. And just sign up through the United Way for that?
Or just even get in touch with us.
Okay.
Yep.
Great. Well, I thank you so much for the work you're doing and for
Thank
coming
you.
on and letting us know about it, because that's really important that people know that all these amazing things are going on in the schools, besides kids going to school and
Wonderful.
coming home.
Yeah.
There's a lot more that goes on, and a lot of thoughtful planning that goes on. So many different
Yes.
agencies that you work with, and the coalition itself doing work in schools. So we thank you for that, and
Thank
we thank
you.
you for coming on, and we'll have you back, and we'll find out the progress. We'll find out what's
Absolutely.
going
And
on.
I would just pitch that if anybody wants to join and be on my spreadsheet of coalition members, feel free to reach out to me as well.
Okay, that's great. So thank you, and I just want to give some reminders of some of the campaigns at Public Health as we work on our Community Health Improvement Plan. To know your number, know your diabetes risk. Is your blood sugar over 100? Something to ask your provider when you go in for your next visit. Make sure you're getting checked. Secondly, courage is knowing when to ask for help. Discuss mental health with your provider as well. These have been some really difficult times, and we're seeing a lot of behavioral health, mental health issues in our community, and we just want to remove that stigma. It's nothing to be ashamed of. Please speak to your provider. They can be your first step toward getting the help you need. And finally, is your blood pressure over 120 over 80? That's 2 overs, but know your number. Make sure you're having those hypertension checks regularly. So make sure you talk to your provider, get back to your primary care doctor. And finally, I want to put in a little plug for our public health clinic on 18 Mulberry Street. We have an immunization clinic on Tuesdays from 4 to 7 and Fridays from 9 to 12. We have a sexual wellness clinic every Thursday from 3 to 6 p.m. And hopefully, weather permitting, you'll see our van tooling around town at the library, at Leighton House, and different places. So stop in and get your immunizations. And that's all I have, folks. Have a wonderful, healthy week.
Awkwardness. I see no difference.
Okay, fine.
Okay, so you go up to him and you say hello.
something easier, like a third of 33.
No, you don't got that. No. Yes!
There are solids, liquids, gases, plasma. Blinds, please. Now, states of matter are comprised of...
Come on, honey, dinner.
Places.
Come on, Michelle.
My plane got scrapped.
Headphones, please.
Headphones, buddy.
Headphones. Come on.
What?
Hey!
Oh my.
Oh, okay, that's good. What kind of meeting? What were you doing?
It was fine. I don't really want to talk about it.
You never want to talk about it, Trey.
I said I don't want to talk about it.
Wait, Trey, what are you doing?
Just get out!
What is going on with you?
Get out!
Listen to me.
Get out of my room!
Andy!
Get out of my room!